Good afternoon. We'd like to welcome you to today's COVID-19 briefing. My name is Paul Edwards from the Governor's Office, and today we will be hearing initially from Dr. Dunn, our epidemiologist, Dr. Angela Dunn, and she will be followed by Governor Herbert.
Okay, thank you, Paul. Good afternoon. So we have now 3,782 COVID-19 cases diagnosed in Utah. That is an increase of 170 from yesterday, or a 5% growth rate. We've tested 84,697 Utahns for COVID-19, an increase of 4,070 from yesterday, and we're at a 4.8% overall positive rate. We did increase our hospitalizations by 14 yesterday. So total number of hospitalized patients with COVID-19 from the beginning of this outbreak is 315, or 8% of all cases. We now have 39 deaths attributed to COVID-19. That is an increase of 4 deaths from yesterday. 3 out of the 4 deaths were in residents of long-term care facilities associated with an outbreak at that facility. And the 4th individual was hospitalized at the time of death and had underlying medical conditions. 3 were residents of Salt Lake County and 1 of Utah County. So we have started to look at our case trends by smaller areas, and we've noticed some promising trends in these areas. In particular, Summit County was our first hotspot in Utah, and they responded in part by issuing a shelter-in-place order, increasing testing, and continuing contact tracing. And they've seen successes due to these efforts. They've had a steady decline in cases since April 2nd. So this is evidence that social distancing and our public health actions are working to control this pandemic. So we encourage all parts of Utah to continue adhering to the governor's stay home, stay safe directive, so that we can continue to control this pandemic. And part of this is going to be continued testing expansion. So as a follow-up to yesterday's multicultural outreach efforts, we're announcing today that starting next week, every Tuesday and Thursday, testing will be available at Utah Partners for Health Clinic in Midvale. And of course, testing will be free at this center as well. I'm happy to take questions.
Thank you, Dr. Dunn. There's been some talk about herd immunity. That the idea is being that the curve has been flattened, and at this point, some people are saying the virus has to work itself out and just go to everybody, so to speak. What would happen under that kind of scenario?
Yeah, so for any infectious disease, we do like to see herd immunity. This is what we use for measles and other vaccine-preventable diseases. Herd immunity means when there's enough natural immunity or vaccine-induced immunity throughout a community to protect those who don't have immunity from getting the disease. So that would be around 60 to 80% of Utahns needing to have immunity against COVID-19 to achieve that. And really what it's going to take to achieve that is a vaccine. So our federal partners are working hard on that. We're still about 12 months to 18 months away from having a vaccine, but that is what's going to give us immunity. Okay, perfect. Thank you so much. I'll turn the time over now to Governor Herbert.
Good housekeeping, Paul. Thank you. Good afternoon. As always, we're honored to have you here as we give our briefing on where we're at with the COVID-19 pandemic and the progress that's being made. Throughout these briefings, you've heard me say, and it's true, we're making significant progress in the right way, thanks to the work of so many people, particularly the public, which is following the directions we've given them as far as what they should be doing, safe distance, social distancing, we talk about it, wearing masks and such things. That's helped us as we move the dial when it comes to the trajectory of this coronavirus and its impact on our economy and on us as people in the community. Our unique Utah Leads plan, which I hope everybody takes the opportunity to read. You can go to coronavirus.utah.gov and you can read through the entire plan. It's a new and improved plan. We call it 2.0. And so you can read through that. And I think it will help as you go through this, and probably what I'm going to say today, you'll find in specific detail in this plan. With this Utah Leads Together plan, we now have the three stages, which were urgency, which we're in now, moving to stabilization, and then to recovery. But we have four color codes to help us navigate that array of opportunities and possibilities. The first category is red, which is high risk. The second category is orange, which is moderate risk. The next category is yellow, which is low risk. And then green indicates that we, in fact, have a new normal risk. It's not going to be exactly like it was before for obvious reasons, but at least until we get a vaccine and the ability to inoculate ourselves against the COVID-19. But we'll be at a green stage where we can, in fact, move about, and even though we still need to be cautious, we'll have a new normal and back to full activity. Each level does require some list of precautions that we need to take. As we move towards stabilization, this will indicate to us where we are in our movement towards normalcy and what the directions are for us to follow and what level of activity as we open up the economy we can participate in. I'd like to just make mention that we're about managing risk. There is no belief that we can get to zero risk. That's never been the case in life, and certainly not the case with this one. So there's no such thing as zero risk, but we're going to try to manage it. And we also recognize that different parts of the state maybe have different risk factors. So some of the geography may vary and the risk condition may vary based on the region that you find yourself in our state. For example, and I just use this as off the top of my head, if we had, say, a situation in Millard County that was yellow, which is low risk, but in Delta, we had an uprising of the COVID virus and we had a hot spot there, it may be that Millard County might overall be yellow, but the Delta area might go back, in fact, to be to orange in a more moderate risk situation, even go to red if it had a high risk situation. So hopefully as you read through the plan, and as we talk through it a little bit today, we all need to understand we have responsibilities, that we will continue to be under a level of risk, that we want to minimize those risk factors for ourselves and our neighbors and the community at large. So as I've said before, this plan is not my plan, it's our plan. And we have responsibilities, all of us, to in fact follow the directions and the guidelines to help us. And these are put in place really to protect our own health. They're designed to help protect not only the health of ourselves, but our families, our friends, our loved ones, and people in the community at large. So go to, again, coronavirus.utah.gov, follow the links to Utah Leads Together 2.0, and you'll see this color-coded health guidelines. Regardless of the level at risk, there are some things which will always pertain. We're going to need to follow. And let me just mention some of these. One, we need to be exceedingly careful, particularly for those in our high-risk populations, those 60, 65 years of age and older, those that have underlying conditions of obesity, diabetic, respiratory ailments, those kinds of problems. Sometimes that's more acute in senior citizens, but those high-risk populations need to be extra careful. We also should have a heightened level of common sense and personal responsibility. We cannot, even though we try to make as much detail and specifics in the plan as we can, there's no way we can anticipate, every situation is going to take place, as unique as it may be. So we ask all of us to take personal responsibility and bring some common sense to bear as we apply the directions that we have here to help us perform under these difficult situations. We also like you to stay informed. Again, we have information on our webpage is updated every day. You have real information in a timely fashion, which will help you with the latest information of what we're doing. Last but not least, we certainly want you to be vigilant about hygiene and cleaning. We've talked about this ad nauseum. You're probably tired of hearing it, but we still find that people are not following these directions, which is a little bit surprising to some of us. One, wash your hands with soap and water, hot water if possible, but wash your hands for at least 20 seconds. Use hand sanitizers, particularly when you're out and about and can't wash your hands. Hand sanitizers should be used often, particularly if you have interaction with other people. Use masks. This is one that's really frustrating because when we go outdoors, particularly if we go to the grocery store, retail outlets, we should all be wearing a mask. That helps protect ourselves, but it helps protect others that are outside too. I do see that the employees of our retail outlets, our grocery stores, are wearing masks now more diligently. That's a good thing, and we need to do it if we want to slow down and stop the spread of the coronavirus. That's an easy thing to do, but we need more participation. Obviously, cover our coughs and sneezes with elbow or hanky, but not your hands. Clean high-touch surfaces. You see Paul here cleaning the high-touch surfaces here on this dais here to make sure that we don't transmit any of the virus, the coronavirus. Again, have Clorox wipes ought to be available, handy in your home, and certainly in our retail and business outlets. We should avoid touching your face and refrain from shaking hands. That's the new normal for right now. Now, we'll be living with this for a while. This is not going to go away overnight. It's going to take us a while, but if we continue to do our part, follow this, make this our new habits, and follow this routine, we'll get there quicker. Earlier this week, some of you know, I received a recommendation from the Public Health and Economic Emergency Commission to move the state of our state from high risk, which is red, to moderate risk, which is orange. Again, part of our efforts, our plan has informed us as far as what we should be doing. And we have this now a commission formulated by the legislature, which allows us to have additional detailed discussion. And I've received that recommendation here just a couple of days ago. That recommendation is now under review. There's a few things in there I've looked at that I have some questions about. But I do want to mention today that because there are many moving pieces and things out there, people need to prepare to get ready, associated with moving from high risk to moderate risk. I want the people of Utah to know as soon as possible that I plan to change the risk category for much of the state from red to orange as early as the end of next week. That would be May 1st. It's been a common date out there. I'll give you some information on why we're doing this and what's the data tells us. But we want people to be ready and anticipate that this is going to happen. Again, I need to make sure that we're exceedingly clear on this. Moving from high risk to moderate risk does not mean we're going back to business as usual. We may not see a lot of change in our own personal behavior, but we'll see opportunities for businesses to open up and have opportunities to interact more than we've done in the past. So this is a good news thing. It's a step in the right direction. It means if we see risks that take place, if we're moderating such, or more of our economic activity can revive. But that's only through the vigilance and abundance of precaution that we, the people, take. So it looks good. but we have to make sure that we do our part to make sure that we continue to trend in this correct direction. Now, I've had a couple of questions, as I mentioned. We're trending in a good direction. If the trend continues, we're going to be in good shape. But before I'm ready to formalize moving from high risk to moderate risk, I'm going to ask the Public Health and the Economic Emergency Commission to come back with some specific recommendations on two different issues. First is the caring for high-risk populations. I need to be certain that we're doing all we can for those who are going to be most vulnerable as we in fact shift into a more moderate situation than we've had in the past. How are we going to protect the health and well-being of high-risk populations? So I need their specific guidance on, one, how to best communicate our immediate directions to the high-risk populations, wherever they may be. Two, how to address those who are at risk and want and need to work. How are they going to go back into the workplace, which may be a little more difficult for them. They may be a little more vulnerable in some of our younger populations, for example. How to support businesses as they learn how to serve high-risk populations. So as we open up opportunities for them to go and participate, what are we doing on the commercial side to provide accommodations for their high-risk populations and protect them? And last but not least is, what are the budgetary requirements for us to do these things? And the legislature, although they have monies coming in, we have this federal money and our own monies and our rainy day fund, et cetera, which are part of the solution, we need to know what the costs are going to be and how we in fact budget for these at-risk population needs. The second area is I need to better understand if there in fact are some geographical areas of concern. So are we going to treat the entire state the same, or is there going to be some variance based on the region and the unique conditions we find in some of the areas of our state? The Utah Leads Together plan does anticipate some regional differences, and I need to have some recommendations as far as how we will in fact address those things. Changes to our health risk guidance needs to be taken into account because of the potential geographic concerns and regions. So with that, let me just indicate again, what is directing our decisions on this? How do we come up with these kind of conclusions? This is not something we're just taking out of the thin air. This is not something that's directing us, we're being directed by fear or politics. This is something we're doing based on data. And we're looking at the important data we have and what the outcomes that it produces to us as we move forward, so we understand where we are at with this fight with the virus. For example, our state data dashboard are regularly measuring the trend of new hospitalizations. They tell us how the virus is spreading among us as people, and if we have acute symptoms, we go to the hospital. And so those new hospital populations, new admissions, are an important factor to help us understand the transmission rate, the infection rate as we go forward. The number of new hospitalizations has been declining in Utah since April the 8th. And using our conservative estimations of the data has declined by 18% over the last 7 days. That's good news for us. What we estimate that this trend means is that where we used to have one person that was infected infecting 5 others in the marketplace out there, we now see the infection rate spread down to almost 1-to-1. Once you get to 1-to-1, that really is stabilization. And of course, our goal is to get to 1 to less than 1, which means the numbers will start eventually shrinking that have the coronavirus. Secondly, we're looking very closely at capacity data. Our hospitalization numbers have been stable for the last 2 weeks. Currently, the statewide ICU utilization rate is less than 17%. We have significant headroom when it comes to ICU bed space. Over the last 2 weeks, ICU utilization has hovered between 15 and 17%, so we're pretty well stabilized there. Statewide non-ICU bed utilization is currently at 5%, which means we have a lot of hospital beds available. And so hence we've opened up elective surgeries to use that capacity. The demand to treat non-COVID-19 patients, we have the medicines, we have the resources to help them now. So this demand can be managed based on our current hospital population as we open up that aspect of our medical needs out there. 3, we're closely looking at some of the process data. Our testing capacity, which has been the challenge. I was just on a phone call with governors and the vice president earlier today. It still is a reoccurring issue to be able to test and analyze those test results, and then hopefully be able to be more strategic in how we in fact address those populations which are infected. Approximately 2 weeks ago, we've moved from just few hundred per day to 5,000 per day 2 weeks ago. And now the good news is we can test now up to 9,000 tests per day. So our capacity has increased dramatically. We are now regularly doing, I think we just did about 4,400 here this past day. We're regularly doing over 4,000. That's good news. And the good news is we still have capacity. So we invite people to get tested. That's an important part of this, knowing where the virus is at so we can isolate it. These numbers provide confidence that our testing ability allows us to closely monitor what's going to be happening in the marketplace. And so if we see any hot spots, we can catch it early and then take whatever corrective action is necessary so we can effectively manage the spread of the coronavirus. So a lot of good things happening there with our testing. By the way, we are the 4th in the nation per capita in being able to test people, and that's trending higher every day. Our trajectory there is good when it comes to testing. So these are just some of the factors that guide us and inform us as far as what we should be doing and what we are able to do as we follow our Utah Leads Together plan. Last but not least on this issue, public health officials, when they find people that are infected, they go back and they investigate who they've been in contact with. Sometimes that's a memory quest. You remember who you saw and who you met and spent some time with, and then go back to talk to those people and see if they've got any symptoms, maybe to have them get tested. We've used technology now with a new Healthy Together app we introduced here just a couple of 3 days ago. Again, then you can download that from Apple or Google, Healthy Together app, which will help you be informed as you travel. Again, it's voluntary. You control the data. You own the data. You can delete it anytime you want. It's automatically deleted every 30 days. Your health issues are deleted automatically every 30 days if you allow it to be collected in the first place. This will help us find people that have been maybe unwaringly exposed to the COVID-19 virus and make sure that they know about it, that they should be watching and maybe go get tested. So again, help us be more strategic. You should know that we have 1,200 state employees that are volunteering to work on this contact tracking and tracing effort. This is a significant expansion of our efforts to try to make sure that we know who's got the coronavirus and to help them and to help others that they might have exposed to it. We have about 1,000 volunteers at local health departments around the state. So we have a significant body of people volunteering their time and efforts to help us with this issue. This is going to help us get a better picture of where we are and our readiness to move from one risk rating to another. So I appreciate what's taking place here, which is allowing us to move forward. Let me just conclude by saying this. Our decision to change our health risk rating from red to orange will be made with data-informed judgment. The data is what's going to drive us, which is what is going to help us make the decision. It's not anything else. As I mentioned, it's not because of politics. It's not because of some fear-mongering that's out there. It's based on good data that tells us what the science and what the medicine would dictate to us to do. As I said earlier, if trends continue in the direction that they've been on our key indicators, I plan to formalize the recommendation to change the risk category of much of the state from red to orange as early as the end of next week, thereby opening up important sectors of our economy. And again, I just would emphasize that maintaining this trend, maintaining this trajectory is really the responsibility of all of us. We can control our destiny here by doing what we should be doing to protect ourselves and our loved ones, following social distancing, wearing masks, and the things that I've already mentioned. So next week, we'll bring to you some details of what this was going to look like as we move towards the end of this week. if the trend continues, it's not a matter of what you can't do, it's going to be more of what you can do. And so that's going to be a welcome change for us as we move from red to orange, hopefully by the end of next week. So with that, before I open up for questions, let me just mention one other thing that's come up here in the last really 24 hours, and that has to do with our hydroxychloroquine, an issue that I know there are some questions about, and I have questions myself. But just to give a little bit of a history on this thing, in the early days of the COVID-19 pandemic, the concerns that many states had, as we're on phone calls with the White House and others, was shortages of material, whether it be PPEs, personal protection equipment, masks, certainly medicines. And so everybody is scrambling to make sure that they had a supply of these kinds of things to help us, in fact, slow the spread of the coronavirus and protect our people. In that emergency situation, we found some successes in getting our supply chains enhanced, and we saw delivery at the airport with some 757 planes that brought in some equipment for us, as well as other access points that we developed over a very short period of time in a very rushed atmosphere. In addition to the PPEs, though, there was a lot of interest in what kind of medicines could we use to help slow the virus, maybe make it less severe, less impactful, particularly on our senior citizens. One of the various antiviral drugs in treating COVID-19 that was mentioned many times by people is hydroxychloroquine. Unbeknownst to me, on March 31st of 2020, the GOMB approved to purchase 20,000 units of this drug as a potential treatment option for COVID-19 from Meds in Motion at a cost of about $800,000. I also understand that negotiations started at that time for additional supplies of this medicine by our Department of Health at the same time. The fact of the matter is we did not know the details. You can appreciate that we have purchases of many things in the state government. I'm not involved in those negotiations and purchase negotiations and purchase agreements. But as this has come out, I have some questions about how it came about, the transparency of it, and a few other things too. Here's what I know now. I understand that the negotiations for additional orders have ceased. I also understand the state has not yet taken delivery of the initial order of 20,000 protocols of units of hydroxychloroquine. We have, in fact, learned more in the last 6 to 7 weeks since this originally was brought forward and discussed. A lot of people had some hype on it. The President of the United States, as you know, mentioned it. Others have talked about it. And even today, even though the FDA announced just today to not utilize it for this purpose, we still have people that are touting it as a way to lessen the severity of the COVID-19. And there's just a lot of uncertainty as far as what's taking place out there. Bottom line is we're not purchasing any more of this drug, hydroxychloroquine. And the situation in its entirety is now under review by our legal counsel to see what happened and how it happened and why it happened. So with that, we'll just leave it at that. Again, we'll probably have more information on this as we get into next week as the review takes place, and we'll have answers to questions that we don't have today. So with that, I'm prepared to take and answer any questions you may have.
Yeah, Governor, as you look at moving toward this orange and you say that it's data-driven, what businesses are you talking about that could potentially start opening up as a result of this taking place?
Well, the one that most people think about, and probably the one that will be the most visible change, is the ability for us to go from curbside and takeout delivery and home delivery is going to be to open up some of our restaurants for in-house dining. Now, that doesn't mean that it's going to be the way it was before. It's going to be probably some limitations. Those limitations will be such things as making sure that the employees are screened when they come to work for fever, ask about if they have any symptoms, so that they can be screened and make sure that the employees that work there to service the customers are in fact healthy. It will require spacing of our tables, certainly the spacing between those who are customers. The spacing minimum is 6 feet, our social distancing number. That means tables need to be arranged or blocked off so that that can happen. We're going to try to keep areas at a minimum size inside the building, and that's right now technically talked about at 10 per area. And again, still having a social distance of 6 feet between the people. So it'll be, a little less convenient than we've had in the past, but a step in the right direction of opening up dining. Some of those details we'll be working on between now and next week as we, in fact, look and get input from the Utah Restaurant Association and others out there that want to weigh in about how can we do this in a safe environment and start opening up. But that, again, is just one area, but we'll have, gyms, we mentioned will be opening up. We have opportunities for outdoor recreation on golf courses, maybe tennis in certain venues. So outdoor recreation. We've opened up our parks. We hope that by the May 1st that we'll have opening for some of our national parks. We're working to work with Lake Powell to open up Lake Powell and the marinas there on the first part of May. So you're going to see this gradually, incrementally being phased into more open opportunities. It implies that although we would like you to still be careful and do things only as they are essential, but it does allow you to travel more distances that are maybe considered non-essential travel to go to our parks and maybe some of our other recreation areas and visit. So stay tuned. We're going to have more information on that next week as far as the things that you can do and elaborate more in detail on that, Ben.
Hi, Governor. Asking more about the hydroxychloroquine. With the FDA issuing that recommendation today against using it in hospitals or clinical trials, how does that impact what the state will do with that 20,000 it's already purchased?
Well, that's yet to be determined. That's under review right now. We don't have the medicine. It's not been delivered to us, so we don't have it in our possession. I know that we do have some studies that are attempting to be done at the University of Utah, as I understand, on this very drug, some clinical studies to see does it really in fact help people. We had what came out of the VA, which is confusing. The VA said here just a few days ago it didn't show any benefit for 358 veterans. But then we had the Secretary of Veteran Affairs, Mr. Wilkie, come out just a day later and say that's wrong, that we have found significant benefit. In fact, he said this was really not a clinical study, it was a group observation of those who were in the hospital that were elderly and really were kind of in their last time of life anyway. And he said for the younger veterans, the middle-aged veterans, that he's observed it's helped. So who am I? I'm just the governor. I don't know the science and the medicine behind this. I'm going to learn like the rest of you as we move towards this, and I'm going to listen to the scientists, I'm going to listen to the medical advisors, and let them tell me what we should be doing. I know there was hope when this came out, and maybe more hype than hope. Well, I guess we'll find out what the end results will be with this, hopefully, clinical studies and trials. We have a lot of anecdotal evidence where people say it helped me, and I just got through going through the last couple of years on a drug that, it was not FDA approved, but we have a lot of anecdotal evidence saying it helped me. It's called medical marijuana. So maybe this is going to be a similar kind of a thing. We'll have to wait and see, but we're going to follow the advice of our medical advisor and science and make sure that we don't put anything out there promoting by government. What people do with their own physicians, their doctor's advice, we don't want to get between the patient and the doctor. They can decide what they want to do and what's in the best interest of their patient.
Governor, good afternoon. A couple questions here. First off, the questionnaire that Test Utah was doing some questions appeared on it about hydroxychloroquine, and there was some question about that because of the connection between NAMI Health and Mr. Newman's being on the board of Meds in Motion, which was selling the hydroxychloroquine. Because of that, are you concerned about when the contract for Test Utah comes up again on May 30th, whether you will just renew that with the same company or possibly put that up for bidding?
Okay, let me answer that question. One, I believe, and we've asked for that question to be removed from the testutah.com website. That was something we had not really known the connection. Again, there's maybe a little lack of transparency there. That's part of what's going to be reviewed. So I can't give you an answer to all your question, but I know that we've asked for that to be taken off the test site, that question. It really isn't relevant to what we're trying to do with people to get them to get in and be assessed and then decide if they need to get a COVID-19 test or not. So that was inappropriate, I think, to have put on there in the first place. The other issues, again, will be reviewed, and again, we'll probably have more information next week.
Hi, this is Brittany with ABC4 News. Following up on the hydroxychloroquine question, can the state back out of the deal since it hasn't taken possession of the drug yet? And do you still plan on taking possession of it? And also, Representative Harrison, who has been very outspoken in opposition of the deal, says the medication purchase has been compounded with zinc, making it useless to patients with lupus, rheumatoid arthritis, or other autoimmune disorders. So if that's true, and if that's so, was this purchase a waste of taxpayer money?
Well, I would hope not. That's part of the review process to see what the obligations are that we have, and did we get something that was not what we bargained for. So that's yet to be determined, and that's why we are doing a legal review of the situation with our legal counsel and the AG's office. So again, we'll have more information to clarify that next week. Clearly, there's some questions that we need to have answered, and we're pursuing that, and we hope to have answers to share with the public sometime next week.
Yes, I'm here. Governor, good afternoon.
Good afternoon to you.
Governor, did you have any personal, you said it was unbeknownst to you about the purchase of hydroxychloroquine, but did you have any personal information prior to that purchase about the buy, and did you act on it? And then a second question, I have it on good authority that you were told in a letter from respected infectious disease physicians that it was a bad idea to purchase the drug. Is that true?
You know, I know on the first one, and I can't recall the second one, so I don't know. I'd have to check with my chief of staff, see if there's some correspondence that came in that I don't recall. I can tell you, we always knew, I think from the beginning, that it was not without controversy from the standpoint of we had people that thought it was a miracle drug that was going to help people. Not that it was going to be a cure, but that it had hope that it would lessen the severity and the length of time that a person that had COVID-19 would have to suffer. And so it was kind of a therapeutic medicine. And so again, in the rush of what was happening, picture this emergency thing that's happened to us. We're in free fall with the economy and people losing their jobs and the economy shutting down. We had people certainly pushing it, and people thought there was some hope there. But we had pros and cons happening, unbeknownst to me, that we actually had, of course, we had this emergency authorization that we have with our health department for these kinds of situations. There was concern about, are we going to run out of this medicine, hydroxychloroquine, because other people are going to use it for COVID-19, and those who needed it for lupus or arthritis or other needs that they would not have it available. So there was at least a concern about, are we going to run short of the product. And so that seemed to be kind of hedge your bet kind of a thing. I'm not sure that that all was correct, but that I think is some of the argument that we're being told today of why they moved ahead. And the monies really was federal monies. They've been told we'd be authorized to be reimbursed for monies that we spent on COVID-19, whether it be masks, personal protection equipment, other medicines, other needs, other equipment that we need, in fact, to address the COVID-19. So that probably gave them a little bit of comfort to be able to spend the money, even in a rushed environment. But that, again, those are questions that we're going to have to review here this next week and find out what the answer to these questions are, because we don't know them all right now. I think, by the way, I'll just say this. I think everybody dealt, at least on our side of the equation, in good faith. I think they're trying to find a way to alleviate suffering, to find maybe hope, to help people that had the COVID-19 to recover. I don't think anybody was doing anything other than trying to find a way to solve a unique problem that we've never seen before. This is brand new. It's very uncertain. It's troubled waters we've never navigated before. So I think, at least on the government side of the equation, it was all done in good faith with the desire to help the public. I can't answer for the other side of the equation right now.
Hi, Governor. This is Roger McDonough with KCPW Public Radio, and I'm going to follow up on the topic at hand here. Just on that legal review around hydroxychloroquine, you said you're not involved in all purchasing decisions, but I'm wondering, have you yet been able to determine how this pharmacy company, Meds in Motion, ended up with the contract with the state to supply this medicine? And then the United Utah Party in a press release today says it's calling on the state to cancel that contract because it's an unproven medicine for treating COVID-19. We know that PPE and ventilators work. We don't know if this works. I'd ask for your response to that as well.
I'm probably not prepared to answer in detail the question that you've asked, because I don't know. I've heard different things in the last 24 hours as far as what and how it happened. And how the health department, along with our Office of Management Budget, authorized this to take place. Again, I think no reason to think they weren't doing it in good faith, but nevertheless it happened. And we just need to find out what that means and what caused it to happen and why do we, and again, maybe we didn't make a mistake. We need to wait and see. So I'm just a little reluctant to say how we got involved, because I don't know for sure, although I've heard different stories. And so why don't you just hang on for next week and we'll be able to maybe clarify some of those things.
Yes, good afternoon, Governor. Can you guys hear me? Oh, wonderful. So pardon the redundancy of the question, just wanting to make sure that I'm understanding correctly. Do you know if you'll be able to get a refund, at least for that original 20,000 dose purchase at $800,000, or is that still something that needs to be worked out? Secondly, we know that Representative Ray Ward proposed an amendment to those $8 million to have some sort of a guarantee that they would be used to purchase some sort of FDA-approved treatment that would work for COVID-19 patients. We know that that failed. Is that something that you're willing to reconsider to add to that money? And also, is that money only being held for treatment purchases, or would you also be using it for PPE and other sorts of things?
I think in answer to your question, that the money being set aside by the legislature is really to anticipate needs that we will have for COVID-19 for treatment, whether it be drugs, whether it be personal protective equipment, masks, etc. So the money will be set aside there to be used as we have an emergency need. That's probably prudent and wise. We've taken off the table any additional purchase of the hydroxychloroquine product. That's not going to happen. And so that leaves us to the question of about the 20,000 vials that we have now and that we've spent money for. Will we be able to get a refund on that? I'm hopeful. That's why it's under review, to see in fact what can be done. It'd be nice if they just said, we've had a miscommunication here and we're apologizing, here's your money back. We have not received the product. So that's part of why we're undergoing a review of the entire process and a legal review to see what our options are. And so, again, I think I'll have more answers for that after we've done the review. And what we're going to do after the review remains to be seen. One last question.
Hi, Governor. Carter Poppy with the Times Independent in Moab. I'm interested to know more about your thinking on local differences on the Utah Lease Together plan. Lieutenant Governor Cox said Monday, there is no county that is more unique than what Grand County faces, unquote. He said that in reference to a question about Moab's economic and public health situation, but I think a lot of local health and elected officials would agree. So to what degree do you intend to give local health departments and municipalities latitude to pass and enforce their own health orders and to work with the Department of the Interior on the question of reopening national parks?
Well, as you can see, how I've conducted this over the last 2 months now, I really have been giving deference to the local elected officials and the local regional health departments. I think they know their areas better than anybody, and so I'm reluctant to say, well, I'm going to dictate to you how to handle your own local needs. So we'll have deference given to regional health departments and regional local elected officials as they see a need. We're not going to be just willy-nilly in how we give directions out there. It's going to be based on, as I mentioned, the data, the science, the medical advice that we receive, and what that tells us what the next step should be. I fully expect as we move forward here, we're going to move from red to orange. And it would be nice if that happened throughout the state. We'll have to wait and see what the data informs us to do. But even if we did it all to orange, it may be that in the next 2 or 3 weeks, there could be a hot spot come up that we'd have to move back into red. Or as we move in a month or 6 weeks or so from orange to, say, yellow, does that mean all the state will go to yellow? Maybe there's some hot spots still that need some extra work. And so they will stay orange while the rest of the state could go to yellow. So there's going to be those opportunities for variation. And we certainly will look at the local elected officials, and particularly local health departments, to tell us what to do, and then we'll make a decision on a statewide basis, but it may be different, may not be all the same. So again, this is a work in progress. I think we're in a very good place in the state right now. The work of many has got us to here. We're certainly better off than most any other state in America today, and I will predict that we will in fact recover quicker and faster and better than any other state in America. The things that's made our economy strong, the diversification we have, are still in place. The principles that have gotten us to be the best performing economy in America are still in place. 70% of those people we have on unemployment right now are furloughed, which means there's a job waiting for them to go back as businesses can open up. So there's very good reason for us to be optimistic and hopeful that as we start to turning the corner, that our future is going to be bright over the next few weeks and few months. So I'm optimistic and hopeful. Again, it's up to us to make sure that we all do our part to make sure that that happens. If we all say the rules are for everybody else but me, it may be slower to happen than it otherwise would be. So let's all knuckle down, work together, and follow the directions. Thank you. Good luck and God bless you.